Our good friend Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, with us live in our studio. Joe, what's on your mind this morning?
Hey, Ray. How are you today? How's the week going?
It's going good.
Good, yeah. In the last 3 days, two of really some of the greatest comebacks from sports injuries have taken place, and I want to highlight those a little bit. As I was doing my homework and looking this up, there was a couple top 20s. I know you guys love your top 20s of sport comebacks. What might be one that you guys might think of that would be sport comebacks from injuries that were amazing or inspirational? Can you think of any that a couple, I love things that take place in Northeast Ohio. One of them in 2008, Byron Leftwich playing with a broken ankle. I was at the game covering for Akron U. His teammates carried him
Up the field.
They show that tape all the time in sport world. Of course, in the Olympics in 1996, Carrie Strug with landing. And, I'm not in favor of people playing with fractures. And so she had a stress fracture that had, but she competed and won the Olympics. But in the last 3 days, two that I want to highlight. One, of course, amazing, inspirational, Tiger Woods. We talked about Tiger Woods' lots of injuries. In 2008, they said a big comeback with the double stress fracture. But the big thing was his spine problems in the mid-2000 teens. 4 surgeries he had, a couple where they tried to do repair, didn't work. They end up having to fuse him. So they did 2 surgeries. The last one was 2 years ago right now in April, right about now. 2 years ago, April 2017. There were most people in the medical community, especially the surgeons that do this. I read from a professor of orthopedics, spine surgeon at Northwestern. He says he does about 10 of these a week. He said if you'd asked him 2 years ago the chances Tiger Woods plays in a tournament, let alone wins the Masters, 0%. So that you can live a good life, reduce your pain, but hitting a golf ball at a competitive level with all the rotation and spine and trunk rotation that you have to and club head speed that you have to generate. Unbelievable what Tiger Woods did on Sunday before all of our eyes. And you have to say, the perseverance, the resilience, the positive mental attitude that he showed to get back from that is just amazing.
Not only physical, Joe, but mental. Think about certainly the things that he got himself into, and then the mental strain, and then the physical with the back. This guy has come from way back when no one ever thought he might even make the course again.
Right.
To winning the Masters. It's something else.
Right. So that in the next few months and years, I will use this in my office to motivate young athletes. Yeah. When they're down and they think they're never, and when you're in the middle in the throes of an injury, especially a long-term several-month injury, sometimes kids lose that. They just don't believe that they're going to get back to where they were. And the story of Tiger Woods is one I'll probably use in the office for the next several years.
For sure.
The other story, Monday in the Boston Marathon, and the highlight of the young man from Talmadge, Ohio, right?
Yeah.
So Micah Herndon, you guys probably talked about that as there's now it's gone viral as he literally crawled across the finish line. That people were saying, geez, what was he saying over and over again? He was speaking to himself. He was talking, this Marine from Afghanistan was talking about 3 of his brethren that he lost in the battle with him. He kept repeating their names over and over. He cramped up. He collapsed near the finish line, and without help on all 4s, he crawled across the finish line.
And a lot of people wanted to help him. He just said no.
He said,
Let me do this.
Yeah, pretty amazing story from right in our area of Talmadge, Ohio. There's another one that occurred in 2012, and and I love this one too for sportsmanship, there's a young girl who collapsed about 20 yards from the finish line. And the other girl who had won the mile, this was the 2 mile, in the Jesse Owens, stopped, helped this girl, picked her up. The girl had been ahead of her, so she walked the last few paces, literally carried her and let her finish ahead of her, had her actually pushed her across the finish line and finish ahead of her. And that was a pretty amazing story that happened in Jesse Owens. People that were there were saying tears in people's eyes and cheers throughout the stadium, and a great show of sportsmanship. So some of those
It only doesn't happen in the movies, right? It really
can happen in real life. Yeah.
With us, Dr. Joe Congeni, Akron Children's Hospital. You mentioned the back with Tiger Woods. I wanted to bring this up because yesterday I was reading that quarterback Carson Wentz is still having problems with his back, and he had those small fractures in his back that forced him out of action in the second half of the NFL season. The Eagles have since let Nick Foles, their other quarterback, go by way of free agency, but Wentz is still having some back pain and not there yet. Wanted to ask you, not specifically about Carson Wentz, because you haven't seen x-rays or anything, but we've talked about these small fractures in the back. You know, can these be long-term? Do they heal? Is it case to case? Talk a little bit about this sports injury.
I mean, now you're talking my language. You're living my life. I mean, every single day I see several of these stress fractures in the low back. Unfortunately, with 30 years of being in this field, a lot of trainers and therapists know that we take care of this stress fracture. It's called spondylolysis. And so I get sent a lot of these kids. Some of the tougher ones, the longer it's gone on before it's initially diagnosed is probably the worst prognostic point. So if it's 6 months or a year and a half before we get our chance to get our hands on these people, they're the toughest. And sometimes at the very end range of this, we do need to do a surgery. It's a fusion surgery that we do, but not the same kind that Tiger had. But, where they just fuse where that stress fracture can be. But that's the end stage. That's 3%. When I talk to kids in the office, 80% of kids that go through a period of relative rest, they took Carson Wentz out and he didn't play and probably didn't do all of his lifting and all that over that period of time and was rehabilitating. And then rehab, good aggressive rehab, it's usually about 3 months and people get back to play. Now, the fact that 6 months later still having some pain, concerning. If that's my patient, I'm starting to get concerned. There are a few other things we use. Occasionally, we use a thing called a bone stimulator to really try to get that bone to heal as best we can, because we don't want to go that last step of spine fusion, and especially in young kids. And so we don't see it as often in that age range of athlete either. So Carson Wentz getting it pretty late. The question is, could he have had it earlier in his career, never really diagnosed? That would be not a great prognostic. But I'd have some concern because we now are getting up on 6 weeks, and I'm sure they did everything right with some period of rest and some period of rehab and all that. It would be a little bit concerning to me.
Can it end an athletic career, Joe?
It can. I would say that this is a very forgiving injury, and most people go on to complete their career after this, even no matter how long we have to play it out. If we do these fusions of that small, tiny microfracture, people usually do very good. In my world, that's more likely where I see the fusion than in the Tiger world, where it was the disc that was worn out, the space had collapsed. You know, they have to build up the space and fuse the whole vertebrae. L5-S1 for Tiger Woods. How did he get the range of motion back? How did he get the strength and everything? Incredible resilience, incredible positive mental attitude. And so a great lesson for kids that are in the injured area that you got to work hard and you can get all the way back.
All right. Good stuff, Joe. Thanks for coming in this morning.
Okay, Ray. Have a great week.
You too. Dr. Joe Congeni, Akron Children's Hospital, live in our studio this morning.